Hello, my name is Dr. Peter Sharp. I'm the current Associate Medical Director for Research and Development in the Southern Trust. I'm also a consultant chemical pathologist, and I'm here today to talk about the development of a high-quality research governance service within the Southern Trust. As a bit of a background to this, I came into post in 2008 with the establishment of the Research and Development Department at that stage. This was funded through the Public Health Agency Research and Development Division, which funded a number of posts within the research office, including myself. Previous to the establishment of the Research and Development Office, research approval was granted on a single service basis. So those research projects that were deemed to be medicine went through the medical line, those that were nursing went through the nursing management structure, etc. And we brought all of those trust research processes together. The systems and processes were established to fulfil the requirements of the Department Research Governance Framework for Health and Social Care in 2007. The Research and Development Office is now located in the Ramone building in Craigavon Area Hospital. The R&D staff were appointed, and we have a total of 3 staff: the research manager, research administrator and a research assistant. We have a multidisciplinary research governance committee which was established to review research applications, and that consists of a wide range of professionals from the trust, including nursing, medicine, allied health professionals, psychologists, management, etc. And then in 2011 we took the step of appointing 2 personal and public involvement representatives to the committee, and they have brought a wealth of knowledge and experience and a completely different perspective to our committee meetings. So we're delighted to have a number of clinical research nurses appointed to support the network adopted studies, and that has been very useful in increasing the number and quality of our studies. This is a photograph here of the research office staff. Ariane Knox is our research manager, located in the middle. To her right is Mairead, and to Ariane's left is Valerie. These girls bring an enormous amount of experience and expertise and enthusiasm which supports all of our researchers, and they bring together the full research governance standards and arrangements. So this slide shows our 2 personal and public representatives, Lee Wilson on my right and Eileen Wright on my left. Okay, so this slide shows our clinical research nurses in the areas of cardiology, stroke, diabetes, paediatrics and intensive care, and these ladies have been responsible for greatly increasing the number of research studies in their particular areas, and have really led to a large growth in the numbers of studies that we've been doing over the years since our own R&D office came into fruition in 2008. This just shows some of the clinical research nurses who are involved in the particular areas. And again, as I previously stated, we came from a fairly low baseline level of research studies, numbering 21 in 2007-2008. And that was the year before the Research and Development Office was established. And as you can see, since the office was established and the staff came into post, there has been a vast increase in the number of studies, up to an average now of around 60, but reaching a peak of 84 in 2010-2011, and again a slightly lesser peak in 2013-2014. So I think this demonstrates the effectiveness of having our own local research and development office on site. And local expertise certainly attracts research studies to the Trust, and this has been for the benefit of patients and clients who have now been able to enrol in clinical trials where they can get access to new novel treatments, drugs and interventions. So there have been a large number of achievements, and the next few slides highlights some of the most important ones. Through the establishment of Research and Development Office in our Trust, we have been able to contribute to the development of regional and national processes, and are often asked for our expert advice on that. We've been involved in implementing a web-based integrated research application system, or ARAS as it's abbreviated to. This is an online application for all research projects that are now done throughout the United Kingdom, and this has been implemented nationally and locally as well. It's involved quite a degree of work for the Research and Development Office, and we are able to provide our expert advice for researchers who have to use this system maybe for the first time. As well as that, we have developed a research permissions application process for Northern Ireland and have been involved in producing guidance for applicants and research offices. Another new development several years ago was the opening up of the Northern Ireland Gateway, which is a central point which is currently located in the Western Trust for receipt and distribution of Northern Ireland multi-centre research applications from the UK nations. And again, this has made the system more efficient and has improved quality and turnaround times. Continuing then with other achievements, we have developed our own local processes as well, and we are the first trust within the UK to develop a set of key performance indicators, or KPIs, that we've based on the controls assurance standards and anticipated standards that we can achieve, and those will hopefully be adopted by the other trusts in Northern Ireland as well. It allows us to target particular aspects of performance and to try and enhance our performance on a year-to-year basis. As well as that, we have put onto our trust intranet site advice for junior doctors who might have to manage in an emergency situation a patient who is involved in one of our local clinical trials. So that information is now available for junior doctors to browse and to look at if they are faced with such a scenario. And we feel that this does definitely improve patient safety and quality. And more recently, we've been asked to develop an e-learning package for junior doctors on the emergency management of patients enrolled in clinical trials, and all junior doctors now participate in that when they come to the trust. And again, we feel that significantly improves quality and safety. And then continuing with other achievements, we have managed over the last few years to develop memorandums of understanding, or MOUs, between the trust and a number of external partners, and this includes the Ulster University, where we aim to enhance education, training, practice development, research and innovation within health and social care related areas, and also with the Craigavon Borough Council to work together in promoting Craigavon as a centre of excellence for life sciences. And again, those external communications with other bodies have been very useful and informative. This slide shows the signing of the MOU between the Trust and the Ulster University. And this slide shows the signing of the MOU between the Trust and Craigavon Borough Council. We pride ourselves in the Southern Trust Research and Development Office in turning round our research governance approvals as fast as possible. And here we're hitting a very high rate of 100% studies approved within a 30-day period for the last 3 years. And this is an exceptional achievement which is unique in Northern Ireland Trusts, something we pride ourselves in and wish to maintain at this current level. Every year we have to produce our figures for the Research and Development Controls Assurance Standards, and this slide shows that our rates of achievement are in the substantive category at well over 90%. So what are our future priorities? We're always very keen to support research outside the medical area, and particularly in the areas of nursing, midwifery and allied health professionals. We're also keen to promote European funding opportunities to support the development of applications, and also very keen to establish and support more recently established clinical research networks for mental health and gastroenterology, and also to undertake respiratory studies in the Trust. And this final slide shows the contact details for myself and the other members of the research and development team. So please feel free to contact us at any stage if you require any advice or help.